Well, when I was a kid, the nickname, if you had braces, was something like, metal mouth, tinsel teeth. But no matter what you call them, I've always been happy that I got them.
Yeah, you have a beautiful smile now.
Thank you.
You're welcome.
Thank you.
All right, today we're going to tell you about the very latest in braces because they've come a long way, even in just the past 10 years, and we'll help you decide if your child needs them and when they should get them. Dr. Erin Kopecki is an orthodontist at Dental Associates, Franklin and Sturtevant Clinics. Thanks for being here.
Yeah, thanks for having me.
Yeah.
Thanks so much.
I think that's probably a very common sentiment that people don't always want to get braces, but they're so glad they did. Yeah. I felt like I was on the opposite end. I always wanted them, we couldn't afford them, and all I wanted was to have braces.
Yeah,
so
absolutely.
you probably have kids who are excited and some who dread it, but either way, it's a good thing to do, right?
Yeah, absolutely. I mean, the goal of braces is really to align your teeth and create a functional bite that will last you a lifetime. And keep in mind, it's never too late to straighten your teeth.
We were chatting about that during the break.
I think your teeth are perfectly aligned, though.
They're not.
I think what's interesting is the age of most people who have braces, because there's almost 5 million people in America who have braces, and 78 to almost 80% of them are under the age of 18. Most get them between the age of 9 and 14, which can be expensive years if you're a parent with a lot of kids in that age group. But you kind of started to talk about the problems that braces address. Let's break down a bad bite and then a good bite, because we have an image that kind of helps illustrate this.
Sure, absolutely.
Talk about a bad bite.
As an orthodontist, we classify bites in 3 different planes of space. So we look at it in a horizontal direction, if the top teeth are sticking out too far relative to the lower teeth, or vice versa.
That's an overbite, right?
Most people call it an overbite, but it's actually an overjet.
Okay.
In this image here, this patient is actually exhibiting a crossbite, which is where the top teeth are kind of tucked into the lower teeth. You can see that. Ideally, you want all of the top teeth to be just on the outside of the bottom teeth.
And some of those teeth look like they're up in the gums, and I see that a lot with kids.
Yeah.
Yep, I was actually just going to mention that as well. She has what we call kind of an open bite on the sides, where her teeth actually aren't functioning at all. Those teeth are really not doing her any good at this point. So this is something that you really want to correct. Leaving a bite like this puts a lot of abnormal stresses on some of the teeth, and it can lead to wear and deterioration of your teeth down the road. And it also puts a lot of stress on the bone that the teeth actually sit in, so it can lead to bone loss and gum tissue recession down the line as well.
If someone's bite looks like that, would you do that prior to age 9, or would you still wait until 9?
Well, really, for a crossbite like that, that's something that we really like to correct early.
Yeah.
And actually, I have an expander here.
Yeah,
this is really the
My
appliance.
son just got one of those on.
Yeah,
I'll hold this. This is what you call an expander. So these brackets here go on the back teeth.
Yep, so those are cemented around the back
right
molars,
here.
and it kind of lays across the roof of the mouth.
Okay.
And then there's a little screw that's built into the appliance that you'll activate, and it kind of gradually widens the upper jaw to correct that crossbite.
Amazing. I don't know that they had these when I was a kid.
They might have had an archaic version, but
Yeah.
they've really come a long way.
Okay.
But yeah, expanding is definitely something that you want to do earlier rather than later. Research has shown that the earlier you expand, the more stable it is long term, and the more predictable the expansion as well.
Well, and things like that really help produce a good bite, which we have some illustrations of next. And a good bite, I can imagine, is just when the teeth are aligned. I mean, this looks like a beautiful smile.
Yep, so this is a patient I finished recently, and you can see that all of the teeth, back to front are really interlocked nicely, and then horizontally the top and bottom teeth are actually touching each other, and there's not too much vertical overlap of the teeth, but they're also not open in the front as well.
It looks perfect.
Thank you.
I started, all 3 of my kids have teeth that are just, they
Wonky?
need braces.
Wonky teeth?
Yeah, but I started seeing an orthodontist about 2 years before they even started doing treatment.
Sure.
Would you recommend that to parents?
Yep, so I mean, really the best way to kind of know when your child needs braces is to take them to a pediatric dentist twice a year for their regular checkups. It's really nice at Dental Associates because I actually share a clinic space with our pediatric dentist, and we're on the same page about, really what to look for in developing teeth and when she should refer to me.
That's nice.
Yeah, it is like a really great advantage.
Yeah.
But yeah, a lot of times kids will come in and, there's not really too much going on that can't be fixed once all the permanent teeth come in, and it's sort of a waiting game to see, how the teeth kind of develop and the jaws develop. So that's pretty common to kind of be in a little
kind of
holding
monitor
pattern.
them for a little bit.
Exactly.
You brought 2 examples of types of braces. We see a traditional one there, but I always think it's cool. Kids always get the colored rubber bands.
Oh yeah.
Is that what you use on those traditional metal braces?
Yep.
right here?
So, yep, the metal braces are really, you know, obviously they're the
get,
more
like, school
traditional type.
colors
But yeah,
and-
they can change them every time they come in for a
Yeah.
visit, which is typically every 4 to 6 weeks. And we have, yes, just a rainbow selection of colors that they can choose. And
Invisalign
Yes,
is
it
a
can.
real
This is
great
interesting
option
because you
for
wouldn't
all
even know
ages.
that somebody. Does this come off?
it does, I'll show you.
Okay.
Yep, so it's a removable clear tray.
Mm-hmm.
It's customized to each individual patient.
Just hold that real still so they can get. There you
Sorry.
go.
Yep, there we go.
No problem.
And then pop it on the
show
teeth
how
right
it
up
goes.
there.
Yep.
Okay, sure. Let's see if
Yeah,
we can get it.
my friend had Invisalign. Even as an adult, she just had one tooth that kind of moved.
Yeah.
And she just had to wear it for 6 months to get it back in order. And you just take it out when you eat.
Yep.
You didn't even
Yep.
see it when she was out, and she just wore it during the day.
Exactly, yeah. And the technology behind these trays has really come quite a long way in the
Mm-hmm.
last 10 years, where we're able to get some really, really great results from them.
What people are wondering, when should I see an orthodontist? When should kids get braces? And I know it varies a little bit, but how would you quickly answer that?
Well, I mean, generally it's important to see an orthodontist as the permanent teeth are coming in, just to kind of make sure that everything is
So it's
aligned.
like 8 or 9?
8 or 9, yep.
Okay.
Yeah, around then. And again, the pediatric dentist will also kind of tailor that for you. Some kids do get sort of a limited phase 1 type of orthodontic treatment if things are developing that can't be corrected later or that are going to cause damage to the teeth and gums and jaws as they develop. But, you know, generally patients go into full braces, I'd say around age 12, 13, right around the time when their 12-year molars start to come in.
Okay.
Yeah.
It's great. It's great to see a professional. Here's some information on Dental Associates. You can visit them online at dentalassociates.com or one of their 5 locations in Southeast Wisconsin. All of those are listed right there on their website for more information. Thank you, Dr. Aaron.
Thank you so much.
Appreciate it. And you have a gorgeous smile, too.
Yeah, you do.
Absolutely.